Hello, everyone. Welcome to the breakout session on communication skills for loved ones. Thank you all for your patience. If you've been waiting in our waiting room, we're really glad to have you here. So in this session, we are going to have Marina Di Curizo come and speak with us. Marina is a psychosocial oncology clinician who provides counseling here at CancerCare Manitoba, and she's going to be presenting on communication skills for loved ones. So I'm going to hand it over to her. There she is. So Marina, I've introduced you and your topic, and just before I turn the microphone over to you, reminder to those that are on this session that you can put questions in at any time during Marina's talk, and we'll come back just like we've been doing all morning and get through as many questions as we can before we head to the next session. So that goes in the Q&A box. So please use it throughout the presentation, and we will return to those at the end. So Marina, over to you.
Perfect. Thank you, Donna. Appreciate that. So I will get the presentation up very quickly. Oh, but it wants to go slow. Almost there. Okay, here we go. Okay, so like Donna said, I'll be talking about communication skills for loved ones today. A lot of the presentation is both research related as well as some of my clinical experience. And a lot of my clinical experience kind of validates or confirms a lot of what the research has said. So just keeping that in mind as we kind of go through today. Our equity commitment in preparing for this presentation, I have considered the health equity resource for presenters provided by the conference planning committee. This topic was provided to help presenters reflect on how these topics and content can have good effects or bad effects on people or populations that are underserved. So the topics for today that I'll kind of be going through, we have about half an hour and I will leave time at the end for questions. And I know Donna mentioned that you can ask them throughout. So the main topics will be role of communication in cancer, what that looks like, some key communication skills, both verbal and nonverbal, types of communication, navigating communication with the medical team, and then different ways that we can try to improve communication in general and as a whole. So the first part is the role of communication in cancer. So as most of us know, navigating a cancer diagnosis is a highly individual and unique experience. Even people with the exact same diagnosis cope with it differently, deal with it differently, have different treatment plans, this, that, and the other. So just really realizing that everyone is going to react differently to what's going on with them and based on their personality as well and how they've coped throughout their lives and how it's going to come into play when they have this cancer diagnosis. So there's lots of feelings involved with having a cancer diagnosis, as many of you might have felt. So there's lots of feelings of sadness, anger, there can be confusion, helplessness, and this happens for both the patient, the loved ones, and the caregivers. So it's not just the person with cancer who's feeling all of these emotions, it's really everybody involved. And as we know, it can change over time. So as things kind of progress, as treatment changes or happens, our feelings can change and kind of go through waves, is what I've seen as well, and handling all those. Um, and just so we all know, there's no set rules on what is right to say. We're all human. We all are trying our best. No one is perfect in what they say, but we're all trying to help and support each other, really. And what I've noticed and what's kind of been in the research is that there's clear, honest communication helps both the person with cancer and loved ones adapt and cope as changes occur. So, really being able to have those open conversations, being able to be authentic with our loved ones and our community, our support networks can really help everybody feel valued and appreciated and be able to kind of cope with some of those. Challenges or some of the changes that are involved, which there's lots of change and lots of transition in the cancer process. So, knowing that, we'll go into some of the key communication skills. These are the ones that I've really noticed, and some of the ones that I also utilize in my practice as a counselor, and in my personal life with my family if they're going through things. So, listening would be a huge one that is sometimes underrated. It's being talked about more now, but sometimes the most important thing is not always what you say, it's that you're there and willing to listen. A lot of us have this need to fulfill that urge to help somebody by comforting them with our words and things like that, but sometimes just being a listening ear is so helpful for people and very effective. That's why I put the picture there of you're listening with your ear, but you're also listening with your heart. And listening without judgment, trying to understand what the person is saying rather than having your own preconceived um, assumptions on how they're feeling or what they're going through, and things like that. Really trying to be open minded. And having patience means having, or sorry, listening means having patience. So really trying to utilize that skill as well of being able to listen to them for longer periods of time than maybe we would have in the past, or trying different listening skills. And then listening without always feeling that you have to respond. You don't always have to find a solution or fix everything. I know a lot of us have that tendency, and it's just being there for them and trying not to rush the conversation, rushing it to an end because we might feel uncomfortable. Just trying to be uncomfortable, be comfortable in those uncomfortable feelings, or trying to anyway. No one's perfect, as I said. So doing a lot of listening can also turn into our next skill, which is silence. And just so we all know, it's okay to sit in silence. It's actually very can be very therapeutic for people to sit in silence. Letting your loved one know that you're open to talking whenever they feel like it, not forcing them to talk if they don't want to, but being there when they're ready. And as I've seen in my counseling sessions and with in my personal experience, silence allows individuals to think deeply without interruption, helping them to express themselves more easily. So they might have some unconscious thoughts and feelings that are in there, and when they actually have the silence, that's that time that they're going to bring it out maybe and want to talk about it and stuff like that. So really leaning into those uncomfortable silences is can be very beneficial. The next one is humor. Um, how can you have humor with cancer? But it actually can be quite beneficial as well. Follow your loved one's lead, though. Everyone is different. Um, Everybody has a different way of humor before cancer, now with cancer, after cancer. Follow what they're kind of doing, and follow along. Some people really like dark humor or sarcasm, or just a light conversation. So just being humorous and fun when appropriate, right? If they have said no, I don't like this, or they're not reflecting back that communication, then we kind of go a different route. But humor can be really effective. Incorporating a light conversation, a funny story, a silly video or meme can just make someone's day without realizing it, getting them to think a different way, rather than maybe if they're stuck in a bad space for that day, and you bring up a funny story that could really make somebody's day, and let them have a smile. um, and then humor, as we know, can help to reduce stress, boost mood, and increase relaxation in general. So those just some of the benefits of some humor. So even sending like a nice little email or a text message of a meme you saw just to brighten that person's day can be so beneficial for their overall mental health too. The two E's. These are my two personal favorite: empathy and encouragement. These are the main skills that I utilize. So trying to hear and understand how your loved one feels rather than assuming, like we talked about, trying to understand their perspective, where they're coming from, where they're seeing their life now having this cancer diagnosis can be really effective. And then being able to express that empathy. Some of us think like, how can we express it? Validating their feelings and emotions, saying I agree with you, or that sounds really challenging, that sounds like it could have been very overwhelming. Different statements like that, different feedback can really make somebody feel heard, and that you understand and kind of where they're coming from. You're not judging it, you're providing empathy and compassion. And then when you're doing a lot of empathy, and then empathy, I should mention, can also help with collaboration with your loved one, can help with collaboration with many folks, and kind of reduce that. The misunderstandings or the conflict overall. So that's kind of what the research has shown. And then leading from the empathy to encouragement, I think they're similar. They can be, well, they're all very interconnected, but the encouragement, so providing that hope, confidence, courage, So trying to choose helpful, positive, I like to say realistic. Sometimes the most positive, it's hard to be positive all the time, that toxic positivity, as we've heard. So trying to be more realistic and hopeful words, saying things like grateful, thankful, awesome, great, loyal, trying to incorporate some of those more realistic, positive words is really helpful. Telling people you need to be positive really isn't the best approach to take. So just keeping that in mind, but still having that approach, just utilizing it in a different way with the words and the communication that you're using. Sending inspirational quotes or messages also very effective. Lots of people, a lot of my clients have found people who they follow online um, is really can be really helpful, and it doesn't have to be a cancer client or a cancer patient that they're following. It could be somebody else totally different who's inspiring them, and they're following that. And then give honest compliments. Say, "You look well rested today. You look great today." Things like that. It doesn't have to be. You don't have to force it. Try to make it authentic as you can be. Some people don't like to be hear when people say you look great or you look strong, but finding what works for both of you of the honest compliments. Michelle just had a comment here. Take the lead from others, but also lead them into new ways of thinking, but accepting where they're at. Excellent, excellent comment, Michelle. Yeah, exactly. So the next one, so the nonverbal communication, so communicating without words. So this is kind of our can be our body language and things like that. So trying to maintain eye contact, showing them that we are focused on them. We're not distracted. We're avoiding distractions during the conversations. We're not on our phones. That can be a big one. Like giving them our full attention can be really beneficial, so the person feels heard and not um, like pushed to the side, kind of thing. Having good facial expressions, trying to smile when appropriate. A smile goes a long way. It can anyway. If you provide a smile and they smile back, that can be really therapeutic for people. Keeping an open stance and having positive body language, just like the picture that I put up here. Just having that good posture and being approachable would be kind of what I think has been quite helpful for people. Tone of voice. So sometimes we can have an unintentional, maybe not angry, but a little bit grumpy tone of voice or things like that, just because things are going on, life is happening, and we get frustrated. But really trying to keep that nice tone of voice, because that can be triggering for people. And then use of touch. Everyone is different. Some people enjoy the use of touch, some people don't. Like touching them on the shoulder, giving them a hug, tapping them on the thigh, things like that. Whatever is appropriate, whatever works for you guys, but some people really enjoy that touch. So different topics of conversation. So some loved ones are like, "Oh, what do I talk about now?" And it can be kind of a scary topic to approach. So just trying to remember that your loved one is more than their diagnosis. Yes, they have this um, diagnosis, but they are still the same person that they always were. Try to treat them the way that you always have. Um, Trying to lean into those uncomfortable feelings like we talked about, and then talking about cancer if they want. Some people want to talk about their experience, what they've been through, asking questions, being curious, knowing that maybe you want to ask about how that radiation treatment went. What does that process look like how does chemo look like how does the doctors communicate with you, just asking those really curious questions, and again without that judgment is can be really helpful, and they can maybe feel a little bit therapeutic of talking it out and having their loved ones know what they're really going through. And again, just let them lead the way of those topics. And then continuing talking about different topics such as family, sports, pop culture, politics, fashion, just like you've always talked about, can be really helpful for people, so they know they're not just all cancer. So avenues of communication, try not to avoid the person with cancer. Sometimes most people don't do this intentionally. It's very unintentional, but because we might feel uncomfortable, we can avoid. So trying not to do that, finding a way of communicating that you both find comfortable. So a visit out of the house, doing something you both enjoy, emailing, phone calls, text messages. There's so many ways of communicating now, and finding whatever works for both of you. And then try to incorporate alone time if you are living together. So this is another big one. So if you are living and you're a main caregiver or helping them a lot, taking that time apart as well can be a form of communication. Knowing like you're different people and you might need some time to reflect and work on all of that and work on yourselves and have that time apart. And then find a way to share updates with family and loved ones. This can be a big one for families of trying to figure out who can know what and how are we sharing it, and are people going to feel left out if we didn't share it with them. So really trying to find a way, talking as a family of what is the best way of getting a hold of everybody to keep them updated, would be the best. And maybe for one family member you do one way, and with the other you do another way, but making sure that clear communication of how you're communicating it can be really helpful. So Carolyn just put a comment here. One thing my therapist recommends was to, instead of asking how are you all the time, was to start the conversation by talking about other things. Like you said, they are more than their diagnosis, and your relationship is more than that too. Exactly. Yeah. So true, Carolyn. Good point. Thanks for putting that out there. The how are you can be triggering for people because they don't know what to say. They say, should I tell them the truth? Should I not tell them the truth? Do they want to hear this? Do they not? So yeah, talking about other things, and then as you go into the conversation, you can kind of lead into that, or start talking about it, and it can be more comfortable. Thanks for sharing, Carolyn. So the next part is showing them you care. This is a really big one, and also nonverbal, really, of how you it can be nonverbal. So showing your loved one you care about them in ways you find meaningful. Different things like giving them a hug, as we talked about. Some people enjoy touch, some don't. So of course, following your loved one's lead. Surprise them with books, magazines, music, and/or art you have made. This can be really helpful for people. That's their way of showing that they care, because maybe they can't show it in different ways or they struggle to, but they're showing it with trying to give them extra support in different ways and things like that. Um, Tell your loved ones what they mean to you. This is really important, and you can write it down. You can talk to them about it, saying, I'm not sure what to say, but I'm here for you, or I care about you, or I love you. Even things that you maybe haven't said in the past that you want to say now can be make all the difference for that person. Okay, then we have Jill made a comment. I agree with Carolyn. I hate how are you. I never know how to answer that. I am still me, not just a diagnosis. Yep, so true, Jill. And a lot of my clients feel that way as well. It's a really hard question to answer. Yeah. So practical support. So this is also communicating that you care and communicating how you feel about them. So just providing that practical support that sometimes we don't think about, or the way that we know how to, or it sometimes is the way that people know how to communicate to their loved ones. So sending or making a meal. Always ask. Well, not always ask, but ask sometimes, because sometimes I've had a lot of clients have way too much food in their place, and then it goes bad, or they have to give it out to other people. But it could be really helpful. Even giving a skip the dishes gift card or things like that. Assist them with errands if they need. Say they just had treatment, asking if they need groceries, or asking if you can pick anything up for them can be helpful. Helping with children if needed. As we know, there are younger people who do get diagnosed with cancer, so they might have younger children. Always a helping with that. And then drive your loved ones to an appointment and or treatment. So beneficial. And I put parking here because I know it can be a huge stressor for people, especially at HSD, trying to find parking. So if you have somebody who's driving you there, it can make you just feel that much more supported and comforted, because you don't have to worry about that stress before you got this big treatment ahead of you. And having support during an appointment can make all the difference, of just having that second ear, of somebody there to hear the information and help you kind of have a sounding board to talk about it, or to ask questions if needed. And this approach, from what my clients have told me, can be much better than saying, "Let me know if you need any help," because some people have a hard time asking for help. And this is so true. It's like, okay, well they're offering, but I'm not sure what to ask them, and then I feel like a burden if I'm asking them. So trying to be a little bit more assertive in your approach, can be very meaningful for your loved one with cancer. So communicating with the medical system, I know this can sometimes cause some anxiety and overwhelm with not only the person with cancer, but also the loved ones. It can be very scary and that you're not doing enough. So of course, the first step is getting consent from your loved one to communicate with the medical team as needed. That's number one. Writing down questions for the medical team, take notes, try to stay organized. A lot of people go into those appointments and they blanked. They have no idea what they're saying. They have no idea what they had in mind to talk about. They got intimidated, things like that. So always trying to have notes at least so that you can look when you're in those appointments. And trying to be assertive, not aggressive, trying to be assertive if needed and getting your needs met during those appointments and prioritizing the needs. So, understanding like what is the biggest issue for this person, what do we need to kind of figure out, and then kind of going from there. And also, yeah, prioritizing it to the doctor to make sure that needs are being met and making sure your loved one's on the same page of what the priorities are. And then the biggest one I would say is working collaboratively with both your loved one and the medical team. So, just like that honest communication with your loved one, it can also be that honest, clear communication with the medical team too. So, everyone feels like they're on the same page, everyone feels heard, valued, and appreciated. Trying not to get our defenses up. Sometimes that happens, but really trying to have good communication with the medical team can make your loved one feel very supportive. So that's a really big one. Just being a team, and not just the medical team being a medical team, but you and your loved one being one, and then you, the loved one, and the medical team are all a team in general. It's person-centered care. And then allow your loved ones to help out. Try not to take on all of the responsibility. Take breaks. So this is another way of communicating to your loved one that they have to take. The caregivers or the loved ones have to take breaks too. And this is showing the loved one with cancer that yeah, everybody needs to take breaks here and there. Everybody needs some support or time to themselves, things like that, and not overdoing yourself. Because if you're as the loved one, if you're not good, you're not able to take care of everybody else, right? Because you're feeling overwhelmed. So being cautious. So just a few things that I wanted to mention in here about being cautious what we're talking about. So just tread carefully about discussing past and or current behaviors such as smoking and drinking. Some people feel guilt or shame over these behaviors and can make them feel worse. It's a really sensitive topic. It could be a whole other presentation. We do have a smoking cessation program with CancerCare, but just knowing, just be sensitive about bringing it up, and because it can sometimes, yeah, make them feel worse, and then maybe that can make them struggle with hope and moving forward and things like that. Try not to offer medical advice on things like diet, vitamins, and herbal therapies unless they request or you ask permission. I've heard this from a few of my clients that they just feel like, oh, do they feel like I'm not doing enough? Or, they feel on the defense about their treatment plan and things like that. So just always asking permission. And then, of course, if they're requesting, then yeah, give your opinion on it. But we often like to go to advice because that's our way of helping. But really, lots of it is comes from the loved one of how they can get their best care. Okay, and then trying not to downplay or minimize what your loved one is going through. Of course, like we talked about, have that empathy instead, because downplaying it can make people feel bad. Okay, and then ways to improve communication skills. So just being aware of your own communication patterns and behaviors, understanding the communication patterns of your loved ones, trying to make that more collaborative, having self-reflection, making time for that, trial and error. We're all human, trying our best. If one way of communication is working and another is not, trying different things and things like that. Don't be hard on yourself, and try not to take things personally. You guys are under a lot of stress with this new cancer diagnosis, trying to understand that what we're angry about is more the diagnosis, not at each other. So apologizing when needed. So that was all for today. So the take home messages was mostly use key communication skills, try different ways of communicating, always being having a different approach, always keep learning. I'm still learning. Everyone is still learning. No one is perfect, like I've mentioned, and just don't be hard on yourself. That is my kind of take home message for today. There was a couple questions. Any tips on communicating with a family member with cancer and dementia? Resistance to going to appointments. Yes, that is a difficult one. I haven't had many clients with dementia as well. But yeah, just trying to be firm but assertive approach, firm but empathetic approach, sorry, is the best way to be. Trying to understand where they're coming from and kind of not forcing, but kind of leading the way of getting to those appointments is what I would say. But that could be a whole different conversation.
Yeah, and thanks, Marina. This has been a really excellent session. Thank you for affirming all the comments and questions that have been coming in on from the participants, and thank you participants for sharing them. I think if there are questions that you have specifically, I just would remind folks that please do. You can personally reach out to our patient family support services as well. And so you might meet Marina or one of her colleagues to talk about your specific circumstance. And I think that would really be a great help. So thank you, Marina. It's been terrific. I think you can see there's lots of support here. So thank you.